This patient was referred to us for endodontic treatment of tooth number 19. Patient states that he received a composite restoration, and afterwards tooth just has been hurting all the time. He has to take Tylenol 24 hours a day, round the clock. Tooth hurts too hot, too cold, too biting, chewing on, throbs all day long and all night long. He saw his dentist a couple of times. His bite was adjusted with no help. So we diagnosed the tooth as having irreversible pulpitis with acute apical periodontitis. And as you can see, take a look here. Our estimated working length was 25 millimeters. And it turned out to be correct. Mesials were 25 millimeters and distals were actually 26 millimeters. And you can see the anatomy, the apical anatomy of these canals is interesting. So take a look here. Look at the post-op. That's one angulation. Take a look here. Let me show you a different angulation. That's another angulation. You can see 2 mesial canals, 2 distal canals. Take a look at this angulation here. Now you can appreciate the 2 distal canals, 2 mesial canals, and the length, the working length of these roots. And this one is an interesting one too. Take a look here. You can appreciate the curvature of these canals, and of course you can see 4 canal systems and abrupt, sudden curvature here as well. So as you can see, everything went great. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. But this tooth was a very interesting tooth. Be really careful instrumenting these canals with these sudden curvatures, and of course the length. For the distal canals, I had to use the 31 millimeter files. And for the mesials, of course, we used 25 millimeter files, but the distal, all 31 millimeter files, because as I said, the apical the working length in the distal was 26 millimeters.